Okay, well, hello and welcome to our Lunch and Learn. Thank you for joining today. I think I know almost everyone on the call, but I am Courtney Stellick Freeman. I am the owner of Powerfully Simple HR and Leadership, and we offer outsourced human resources for small businesses in a caring and personalized way. So I am joined today by Dr. Jay Carlile of Carlile Chiropractic. He's going to be giving this workshop on neck and back care for office workers. So a few housekeeping items today. The webinar is being recorded. All of the microphones will be muted, or go ahead and mute yourselves so that we can keep down on background noise. Dr. J will be taking questions during the presentation and after the presentation. So if you have a question during the presentation, please feel free to type it into the chat, and I will be moderating during the presentation, and I will let him know that you have a question. He will be giving time after the presentation for you to ask about any specific issues that may be affecting you, so you can get some personalized care options for anything in particular that you have going on. I'm the most excited about that part of it. I think that is all the housekeeping items. So I will, a little bit about Dr. J. Dr. J has been a chiropractor for 5 years. He owns his own practice in Silverdale. He's been here in Silverdale since October. So he just moved back to this area, and that was most recently from North Dakota. Is that right, Dr. J?
What was that again?
Most recently, you moved here from North Dakota. Was that right?
Yeah, I was working in Bismarck for a couple of years.
Okay, Bismarck, North Dakota. All right, so we've had him here with us since last October, so just about a year at his practice in Silverdale. He's been a chiropractor for 5 years. He has 2 bachelor's degrees, one's in biology and the other in exercise science, and he has his doctorate in chiropractic. He also wanted me to let you know that he has an awesome dog named Lucy, and he takes her everywhere he goes. And he also mentioned to me at the beginning today that he is confident that his dog will start barking during the middle of the presentation, which I think now that we're all working from home is something that we can all relate to.
Yeah, she likes her attention.
Typical dog. So I will hand it over to Dr. J, and I'm going to pull up your presentation, Dr. J, and awesome. You may take it from here.
The cat's currently yelling at me. So there's kind of 2 parts to this whole thing that we're going to go through. The first part are a series of movements and exercises that we can go through that you can actually do anywhere. You can do at the office, and they'll just kind of help with just generalized aches and pains of the spine and the neck and the back. The second part, I'm actually going to take you through a small workout that you can do on your own at home, or you can do at the gym. It only requires a couple tools you can purchase. I think you can get them all from Amazon. They're not very expensive. But anyways, let's get into it. Back and neck relief for office workers. Next slide, please. So the first one we're going to do, these are a series of movements that we're really going to start squeezing the upper and mid back. And this is very beneficial to office workers because we're constantly rolled down. We're constantly rolling our shoulders forward. So the first one we'll start with is the Y position. And you just want to come up to a Y position with your palms facing each other. And the key is to pull your shoulder blades back and then get them down. We don't want to shrug up. And then you'll hold that for 5 seconds, and then you'll drop it down just parallel to the ground in the T position. And what you'll feel when you go from like the Y to the T to the W, etc., is it's going to start working the muscles lower and lower in the back. Next one is pull the elbows in and make a W, and that you can really feel it. You can squeeze down and get those shoulder blades down. And then the last one is you just drop your hands for another 5 seconds. to the L position. And then you relax, kind of shake it out, and then you can go and do several more reps if you feel like it. You start out with 3 or 5, then try to work up to 10. And you'll notice after a few series of going through each letter, it'll start to burn, but it's really going to work those muscles in the upper and mid back. Let's go to the next slide. The head retraction. I highly recommend doing this at a stoplight. So what you do is you try to pull your chin towards your spine and just make yourself a double chin. So you just kind of pull back like that. And a lot of people have trouble with this. What I tell them to do is just put your tongue on the roof of your mouth and push, and it'll help activate those deep neck flexors. All right, let's go to the next slide. So when I say deep neck flexors, these are muscles that are really deep. They sit right on the front of the spine. And so I kind of went into my anatomy program software that I have. And this shows kind of everything peeled away except for those deep neck flexors. And what these muscles do is they help support the normal curve in the upper spine and the neck. And you really want to have that neck have that nice curve because that acts like a shock absorber. Whereas you see a lot of, well, basically all of us, our necks get straightened out or even curve forward. And we call this military neck. And it really puts a lot of pressure on the joints of the neck because everything's stacked on each other and it can't bounce. So the head retraction exercise, its main purpose is just to activate these. You're not going to get a lot of strengthening, but you'll get activation, which we'll see later in the other exercises, how to build upon that. So let's go to the next slide. Here's another great one. This is called the Brugger's Relief. These are actually a series of exercises, but I like showing the sitting one because that's kind of the position we're always in. So with the Brugger's, what you want to do is just sit on the chair with your legs, hips and knees at a 90-degree angle, and you can actually slide a little bit forward. And the key is to have your palms face forward and just have them pulled directly down. And then what you're going to do is you're going to tip your pelvis forward, so arch your back, lift your sternum up, and keep your head in a neutral position. And you want to hold that for a few seconds and then relax. What this does is it takes a lot of pressure. If you feel a lot of people complain about their coccyx or their tailbone hurts, or they talk about their upper back is kind of weak. This will kind of take the pressure off that, and it'll get those postural muscles to kind of relax, and so that you're not constantly just sitting on that tailbone and just really irritating that area. All right, next slide. Oh, we went too far. I think. Go back one. There we go. So these are our cervical isometrics. So if somebody's got a real stiff neck or you're just getting a lot of neck pain, this is a great way to kind of fatigue the muscles so they relax. So all you're going to do is just take your palm, go up to the side of the head, and then just do a little bit of pressure into the hand. You're going to hold this for 5 to 10 seconds. And you relax. You can go to the other side. And this is going to really work the muscles on the side of the necks. So you're going to get a lot of soreness there. This will help relieve that, because if you fatigue a muscle, it tends to relax. I don't know if you guys have ever gone to a physical therapist where they put the shock pads on you. This is kind of a way to do that without using that electric machine, because you're doing the same thing. You're trying to exhaust the muscle so that it relaxes. Let's go to the next slide. And, oh, one more, one back. There we go. So flexion, you can use your fingertips or your palms and just push in. hold for a few seconds, and relax. And again, you can do that as many times as you want. You'll see a lot of people doing this when they get these big tightened muscles, these muscles that come from the kind of the ears all the way down the front. If those are really active, this will get those muscles to relax. Go to the next slide. So this is the extension, and you can use your hands like behind your neck. A lot of people have shoulder problems or they don't have the mobility. Just take a towel and hold it, and you'll push back with your head. You can use a little more strength with this one because you're actually using a lot stronger muscles. You're using a lot of muscles in the upper back. So people with headaches and upper back pain, this is a really good isometric to throw in there every few hours. We'll go to the next one. And rotation, this is my favorite one because it kind of really hits most of the muscles around the neck. What you do is just come up, palm to your temple, turn into it, and hold. And go to the other side and hold. All right, let's go to the next one. The Mackenzie low back extension. This is another one of those exercises where I said there's like 20 different ways to do it. This is just a standing, so I think it's very convenient to do. And the main purpose of this is you're trying to push your low back, your hips forward. So you'll use this with people who have like lower backs where they have a disc bulge or they have really tight hip flexors. So what you want to do is just kind of stand up really nice and tall, push your hips forward, lift that sternum up, and you hold 5 seconds. You can hold up to 10 seconds and relax. The reason these are good for people with disc bulge is because the disc, the bulge will go back, whereas this movement will actually push that bulge forward. So if you do this enough over, it'll take a good 19, 20, 21 weeks of doing it, but you'll actually get that disc bulge to start reabsorbing into the disc and coming forward, which is, for somebody with a disc problem who's got like a lot of lower leg pain, this is, it's wonderful.
Dr. J, what kind of symptoms would someone have if they're having disc bulge so that they might need to do this?
So disc bulge can go from anything from a lot of people just don't have any symptoms at all to just mild low back pain. But what we're concerned of is when that bulge comes back and it starts compressing either the spinal cord or one of the spinal nerves that come out of the spinal cord, then you can get problems where people have pain down their legs, they have weakness and numbness in their legs to even they can't control their bowels or anything like that. And if you're at that point, of course, go to the hospital. But this is mostly for people with kind of the numbness and tingling in the legs. Next slide. All right, so that's kind of that was my in-office care. The next phase, we're going to go through like some workouts where I'm going to talk about mobility and stabilization exercises for the spine. And these are kind of the three things I like to use. We got a foam roller, got a stability ball, and then the lacrosse ball at the bottom there. So next slide.
Dr. J, you had told me before it would be okay, like if someone doesn't have a lacrosse ball at home, for example, they could use a tennis ball, but with like a little different effect.
Yeah, so the tennis ball, if it's really tender, you probably just want to use the tennis ball because it's a little softer. But if it's like an old injury where it's just really knotted up, it's really leathery, and so there's a ton of scar tissue, that's when the lacrosse ball is probably the best bet. So one of the exercises I like to start off most workouts with are glute foam rolling. And, I use this on a lot of people that have a lot of neck and upper back problems and headaches. And the reason is because the glutes attach to the lumbar fascia that goes all the way up the back and attaches in the armpit to the top of the head. So you want to really get this area loosened up so that it's not pulling on the neck and not pulling on the shoulders. So just sit perpendicular to the foam roller, and then turn towards the side you're treating and post out with that arm, and then just roll back nice and slow. And what you're looking for are little tender nodules or trigger points, and that's an area where the tissue has kind of matted together and it's not getting oxygen or nutrients, and so it gets inflamed and then it feels sore. We want to rub those out so that it'll slide past each other, because muscles are kind of like, they're like a sliding filament. And so what I'm talking about is those filaments, they're stuck together. This will help pull them apart. You can do this for 1 to 3 minutes. And next slide. So you've probably been to the gym, you've seen people get on their foam roller and they start sliding back and forth. This is a little different take on that. This is a thoracic extension, where we're using this more as a stretch. So we just kind of lie across it perpendicular with the foam roller right where our ribs end, kind of those bottom ribs are. And then you just kind of lie back. And you can keep your hands down, and then you can raise the arms back to get even more extension. And what this is going to do is this is actually going to stretch the front of the spine and really open the chest and the abdomen up. And so this is a good way to counteract those effects of sitting around all day and kind of hunched over on the computer. And you'll probably start with 20 seconds, to be honest with you, because if you've never done this before. But you know, if you keep at it, you can work your way up to where you do 1 minute, you can do 2 minutes. You know, I've seen people do up to 5 minutes. Next slide. Okay, this is the lumbar rotations with the stability ball. I think it's labeled something different on your handout. But this is probably one of the best exercises for somebody that just has generalized low back pain. This is if somebody's really in that acute phase where their back's just on fire. This is the exercise I'd go to like right away. So just lie on your back with the stability ball under your feet. You want to pull that ball towards your glutes so that your hips and your knees make that 90-degree angle. And then you just want to gently rock back and forth like you're doing windshield wipers. You can go all the way down to 45 degrees, but I wouldn't go past that, because once you get past that, there's a lot more hip involvement, and it becomes more of a hip exercise than a low back exercise. So this, actually, let's go to the next slide. I think it's on the next slide. Nope, sorry, we'll go back. There was a slide I thought I put in there. So what this is gonna do is it's gonna work these small muscles that are around the lumbar spine. We call them, they're rotational muscles, but they're really tiny. But by stimulating those, it causes actually an analgesic effect where it actually reduces the pain that's in the low back. And you can do 20 to 30 times each way. Next slide. So here's like the myofascial release, or I call it compression busting with the lacrosse ball. I think that's a better title than myofascial release. But what you want to do is just, you take the lacrosse ball, or you can use the tennis ball if you want, and you put it against a flat surface, and you put the other side is the soft tissue you're trying to treat. So if you have like a bunch of tightness in your upper back and shoulder, you can put that against the wall and kind of just, you can roll against it back and forth. And much like the foam roller, where we're trying to relax, get those tender nodules to break apart so that those muscles can slide, this does the same thing, but it's even stronger because it's just one point. So you get a lot more pressure on one area. And you can hold this, do circular motions, linear movements. If you want, you can just stick it on there and lie on it, and it acts like a trigger point release, and then it'll help that muscle heal. All right, let's go to the next slide.
Question for you, Dr. J.
Yep.
When you're doing the compression busting with the lacrosse ball,
Right.
should it become less painful over time? Is that how you know it's working?
Yeah, because that inflammation's going to leave, and once that inflammation starts leaving, it's not going to stimulate the nerve endings that are there for pain. And because inflammation is really kind of the root cause of what we perceive as pain. It's swelling around nerves that are there to detect pain. Next slide. Pelvic tilt is a great exercise to start any workout because it stimulates the transverse abdominis muscle, which is a very deep muscle that acts like a casing around the midsection from the rib cage all the way down to the pelvis. So what you want to do is just lie on your back with your knees up and your feet flat on the floor. And then you want to hollow your stomach and push your low back into the floor and tilt your pelvis towards your shoulders. You can brace with your hands out to your side. That sometimes helps people. You can, another way to really get that tilt is you can tap yourself in the sides. That tends to help activate it. What this is going to do is this is a good way to prep before you do any other exercises because it gets the whole core warmed up. It gets a, so that it's firing, and that way it can protect the spine. Let's go to the next slide. So here's kind of a schematic of the whole transverse abdominis. You can see it goes all the way down to the pelvis and goes all the way up to the sternum. And this is underneath the other abdominal muscles, so it's not something you can see, but you can see it acts like a big casing that just squeezes down on itself so that it protects your organs and it protects your spine. Let's go to the next slide. Next one is the glute bridge. So this one, you're going to start lying on your back with your knees and toes pointed slightly out. And you can see how she has her hands braced to the side. And then she just pushes through her heels and then drives her hips all the way up. And then she's going to hold that for 5 to 10 seconds and then come back down and then repeat depending on how many reps and how much stamina you have. So this does two things. This trains the glutes. So glutes are important because that's what holds our trunk up and prevents us from falling forward. Also, by activating and strengthening the glutes, it actually relaxes the hip flexor because the glute and the hip flexor are antagonist muscles. So if you, like say your bicep and your tricep, if you have a tight tricep and you activate your bicep, it'll get your tricep to relax. So that's kind of the hypothesis behind that. Next slide. So this is a knee squeeze. I showed a picture here where he's got like a small therapy ball. You can use really anything. I use a foam roller. And this one you can sit on a chair, have your legs and hips form a 90-degree angle. And then you just want to squeeze and hold for 15 seconds. Even longer if you want, perform 3 to 5 reps. Let's go to the next slide. So the purpose of that exercise is we're actually working what we call the adductors. And the adductors are these muscles that are on the inside of the thigh, and they're really slow to respond to any stimulus. That's why we have to hold it for at least 15 seconds. But these are important because they help stabilize the pelvis. It also works the pelvic floor. You can see how these muscles, they start at those leg bones and they go up into the inside at an angle to the pelvis. So it's anybody with like pelvic floor weakness or just unstable hips, this is a great exercise to do. Let's go to the next slide. This is a side lying hip abduction. And so this does the opposite. This works the outer muscles. We call those the abductors or hip rotators. So you just want to lie on your side, lift the bottom knee up and kick that leg back and have the hips stacked on top of each other. You don't want to fall back or fall forward. And then you want to take that top leg and pull your toe up and then just rotate it inside slightly and then just lift 6 to 8 inches. And what that's going to do is that's going to work the outer hip muscles, which is really important for stabilizing the pelvis from side to side movement. So if you see somebody walking and their hips are just going up and down a lot, they probably have really weak hip muscles. And you do 10 to 20 reps on each side. Let's go to the next slide. So here's a picture of the muscles I'm talking about. These are the outer hip muscles. They are the glute minimus and the glute medius. So the one highlighted in blue, then it's kind of faded. That's the glute medius. It's a little bit bigger. And then deep underneath that is the glute medius or minimus. And so those are kind of the target muscles we're trying to activate. Let's go to the next slide. Here's the bird dog. The bird dog's a good one for general spine stabilization because you're using most of the muscles going up and down the spine. So you want to get into a crawling position with your abdominals braced, and then you're going to lift one leg and then lift the opposite side arm and then point out like you're a bird dog, you're pointing at that pheasant. And then you want to slowly bring the arm and the leg down and lift the other side. And you want to maintain that level pelvis because we don't want to start getting unnecessary hip or shoulder movement. This is a great exercise because it requires a lot of coordination in the brain because we're using upper and lower limbs and we're alternating side. So anybody that's had like concussions or any type of brain injury like that, these type of exercises are actually really good for them because it helps them rebuild that coordination. Let's go to the next slide. This is another exercise, the front plank. I think most people have probably seen something like this. And you just want to get up and stabilize, keep those hips and shoulders level. And this is going to work the front of the spine. So it's going to work what we generally call the ab muscles. And you can just hold for 20 to 30 seconds, doing that once a day. I think that's enough just to maintain enough strength to stabilize the spine. I certainly, if I had an athlete, I'd have them doing a lot more. Let's go to the next one. So here are the abdominal muscles. So the ones on the left, those are the external obliques. So those are the ones on the side that help stabilize the trunk from going side to side. And then the middle one, that's the rectus abdominis. And that helps you from falling back. So that's kind of like those, when people talk about six-pack abs, it's really that muscle they're talking about. And it's got these ligaments over the top of it that you'll see well on bodybuilders, it'll show them have that six-pack. And then the one on the right is the internal obliques. So the internal obliques are underneath the external, but they're on top of the rectus abdominis. And what they do is the external obliques, they go from the upper outer and the fibers go down and in, whereas the inner obliques do the opposite. They start at the lower outer to the upper inner, if that makes sense. So if you have your fibers, hold your hands up like that. That's your external obliques. And you just cross them over, internal obliques. Next slide. And then again, the side plank, it works more the outside. So you can throw that one in there with your front plank, 20 to 30 seconds each side, and it should be good. And I think we're not covering up that nice mustache that guy has, I think, with the pictures. Oh, okay. Everyone can see the mustache. All right, next slide. So going back to that head retraction, this is called the chin tuck head lift. You know, the head retraction, we're trying to just activate the deep neck flexors. This one, we're actually trying to train them and make them a lot stronger because we have to lift against gravity. So what you want to do is just tuck the chin, pause, and then you want to lift the forehead up, but keep the chin tucked. And what this is going to do is really going to put a lot of strengthening into those deep neck flexors and help maintain that curve in the neck. Now, if you actively have like a bad headache or severe neck pain, I probably wouldn't do this because it's probably just going to exacerbate the problem. But you can do up to 10 reps. Do that 3 times a week, 5 times a week, depending on how much you want to get after it. But this is probably the best exercise for stabilizing the neck. Let's go to the next slide. Next slide. Oh, there we are. So this is the prone W's. You know, back when we were doing the Y's, T's, W's, and L's, we kind of got we were working that upper back, mid back area. This is going to be more direct for training that area because we're working against gravity. So you just want to lie face down, have your elbows and hands in a W position and make sure the elbow and wrist are parallel to each other, and then lift the elbow and wrist straight back. So pull the shoulder blades together and down. And you can do 10 reps, 20 reps, how many you'll start low, just keep working up. Let's go to the next slide. And then we'll also do the prone T, or blackburns they call them. So again, get that T position, palms facing down, and really pull those shoulder blades back and down. And you can see with this one compared to the W, this one's going to work more upper back, whereas the W works more mid back. Let's go to the next slide. So here's kind of a drawing or a schematic of the muscles we're working. So on the left, you can see that big trap muscle, and we're trying to work the middle part of it. And then the other side, the right side, I peeled that away, and underneath you can see that strapa muscle that goes from the spine all the way out to the shoulder blade. Those are the rhomboids. Those are really important for stabilizing the shoulders and the upper back, and those get really weakened by office work and computer work. This also does a little bit for the back part of the deltoid muscle, which is good because it's going to help pull those arms back, pull that shoulder back. All right, let's go to the next slide. Well, that's what we have for today. Let's start our questions.
So feel free, if you have any questions about what Dr. J talked about, that's great. And if you have any specific questions about anything that is affecting you right now, that's great too, because we all sit and work at computers all day, and I'm sure we're all experiencing very similar things. So feel free to take yourself off mute and ask Dr. J.
I do have, like I had mentioned when I first started, I have a huge knot right in my shoulder blade right here from just, I don't know if it's from typing. I've been doing a lot of working, and so I'm just wondering if like that lacrosse ball or the last one that last one you just went over, the mid-trap, the rhomboids or whatever, would be good for that.
Well, the first thing is I would get the lacrosse ball in that area just so you can get that muscle to open up and break up all that tissue that's not getting any oxygen so that it can heal. So I would focus, like if I got a lacrosse ball, I'd work that area with every day with the lacrosse ball for 2 weeks. And then I'd start, after 2 weeks, I'd continue using the lacrosse ball, then add the W's and the T exercises in.
Okay.
To start re-strengthening it and remodeling the tissue.
Sounds good.
Awesome.
Hey Jay, it's Jennifer Zuber. When do you think, this is really good information, by the way, all this stuff I've done for years, but I've kind of forgotten about it. Yeah. So I printed it and I'm excited to kind of, do these things. I have 2 sheets. I printed it for work too. So when I have downtime, I'll be able to do that. And then anyway, I have felt so weak recently because of the fact I sit and do Zooms, which is kind of funny that that's what we're doing right now.
Right.
But
a lot of sitting.
A lot of sitting. And I literally just yesterday, I bought little 2-pound weights, just like for my arms, like I could sit and, just kind of do something. So any thoughts on little 2-pound weights, some idea that I maybe could do to kind of just wake my muscles up a little bit?
Yeah, with the 2 pounds, I use a lot of the smaller dumbbells in the office. And with those are great for any like exercise where you have the elbows really extended out, because even a couple pounds, if it's all the way out the end of your hand, it's going to be pretty heavy. But you can do the T's and the W's with those. Plus, I would add some other exercises like shoulder rotations where you hold the arm out and pull the arm back with the weight. Call those external rotations. And there's different ways to do that. You could get creative with those.
I figured they were light enough that I couldn't really hurt myself with them.
Right. And that's what they're for. They're for doing lots and lots of reps, because you're not going to want to do tons of reps with a really heavy weight because it's just going to fatigue you and burn you out.
Yeah. Well, the 2 pounds might fatigue me anyway, but thanks.
If you do enough of them, it will.
Yeah. Thank you.
Anybody else?
Dr. J, I have a question for you.
Yes.
So it sounds like what you're recommending, so those of us who are on the call today, we probably all experience pain due to sitting. That's why we're here. And so it sounds like for those of us who are experiencing pain, what we really need to do is a combination of stretching and strengthening. And in your experience, does that lead to like a pain-free office experience? I mean, can we expect to like feel 100%?
I think you can get close. I don't know about 100%. The key to reducing pain is mobility. Because if you can mobilize a joint that hasn't been moving, it's going to allow that inflammation that builds up in that joint to dissipate, and then it'll stop irritating the nerve fibers that cause pain. So really, movement is your best friend. And then once you are reestablish that movement, we also want to stabilize that joint so that it works in its active range of motion without doing any erratic motions, if that makes sense. So stability, it takes longer. That's something that'll take, months, whereas mobility can, a couple weeks, you can really mobilize an area.
Great, thanks. I really appreciate this too. Like Jennifer said, this is really great information that we don't get a whole lot of. So really appreciate it.
Yeah.
Dr. Carlile, I have a question for you. Is there an exercise that we can do if we start to feel tingling? So I have tingling that goes down to my fingertips. I don't feel it all the time, but I notice that when I am exercising and I'm doing like goalpost to diamond, that I'll feel a tingling happen.
Yeah.
Is there an exercise for that?
So what you're experiencing is sounds like a nerve entrapment, and there's different sites of the body where those can take place. Usually they take place at the neck, on the sides, and they take place in the armpit. So the first thing to do is really stretch the neck out, get this area relaxed so that these muscles aren't clamping down on the nerves that come out of the neck here. Then you also want to, like I would get that lacrosse ball and I'd put it like up into the armpit against the wall and really move back and forth and try to break that tissue up, because it sounds like there's a nerve entrapment somewhere around, because the nerves start at the neck and then go all the way down to the fingers. And those are kind of the most common entrapment spots, especially people that sleep on their sides.
Yeah. Oh, that's me. I think you should do a commercial for why chiropractic care is so good.
Yeah, Tish has been getting on me about that.
Yeah. I mean, I definitely believe in chiropractic care.
Awesome.
Yeah, this has been great.
Anybody else? Should we go to the next slide?
Sure.
Yeah. So there's my dog Lucy underneath. So if you want a new patient exam and treatment, I'll offer this for all you guys for sitting through this. Just $50. Any other questions?
Oh, she's adorable.
So, and your office is located in Silverdale, and there's your information?
In Silverdale at Mariner Square.
Great. Well, thank you. That's a very generous offer. And we really appreciate your time and your expertise today. I know you're being facetious when you say you appreciate us sitting through this, but this is really, really helpful for people who, like us, who feel like we go to our desks and suffer every day. So this is very, very helpful. Really appreciate it today. And to everybody who joined us today, thank you so much for taking your lunchtime to join us. I love seeing all of your faces on here. It really makes my afternoon a little bit better. So I will be sending out the recording and a link to the handouts again. And until then, have a great rest of your day. And looks like somebody has something in the chat. Okay, thank you. Well, thank you too. Have a great rest of your day, and I'll see you guys soon.